So, home care has become very popular in recent years. Family caregivers and patients have become very savvy about avoiding institutional care, successfully aging in place, and getting good home care. What trends have you noticed in home care?
People are realizing that home care is just one piece that's essential for them to age in place. Uh, the earlier that you can begin having somebody help with a few things at home, the longer that that person will remain in the home. We've also noticed that when you have a whole family involved, they're caring for somebody, they're thinking about maybe some help being needed. It's not always the oldest person in that family that is the one that everyone needs to look to who needs a little bit of help. Anybody who might be younger as an aging adult that may have broken a bone, had a minor procedure, found it a little more difficult to get to work back and forth and just function at home, preventing more things from happening to that person are things that we're being reached out to more to help with as a convenience factor.
What is the typical age range of your clients?
We have served people who
And you serve children too, right?
nobody under 17 years old.
No under no
Nobody
one
under 17
okay.
years old. We've served people that are in their 30s all the way until over 100.
Wow. So a big question that people have, caregivers have, when they are selecting an agency, they want to know, is my loved one safe? Who are these people that are coming into our home? And so how do you select the best caregivers, and what training do you give them?
So our carers are the company's greatest asset. We could not provide this vital service without them. It's very important to start building your team right. At this point, we are getting additional carers from people who are already on our team. We're getting people referred to us from other people in the community who know what we do and feel that somebody might be a good fit for us. And we post on a lot of the standard job boards out there too. Regardless of how a person comes into the fold, the first step is to have them take a personality screening assessment. It's called the Care Profiler, and it benchmarks them against other people in the healthcare industry to see if they would be a good professional in this industry.
So you measure their temperament, kind of.
You learn all kinds of things about their personality and the way they would be in certain situations. So before we even consider their background, their professional designations, have role playing with them in the office, and begin our training to condition them the way that we feel is the right way to be on our team. And many of them don't need a lot of additional training.
Okay.
But we have that personality screening assessment, which I've even said, do we really need to keep doing this? But we can be very picky in this particular market too. So being able to filter for the best ones before you do more of the traditional interviewing and screening things has been an amazing tool for us. You mentioned training. In addition to carers just being having the opportunity to learn from our office support, we have an accredited online training university called the Institute for Professional Care Education, which there's a mandatory initial coursework that somebody goes through, and it's module based from there to continue to learn different things that could better their skills and increase the likelihood that we would be able to match them with somebody looking for a particular type of care.
That is excellent. I'm very glad to hear that there is a test for potential caregivers. Over the years, I've had the chance to meet some very good home attendants and some of the very worst. I mean, I've seen some home attendants sit people out on the sidewalk and just leave them there. We've heard all the horror stories, so we don't need to go into all of that. But I think vetting the in-home caregiver is extremely important. You don't want anyone with a bad temper. You want someone who's really committed to the caregiver and the patient.
We set the expectation early on from the job post itself, and those who are on our team that could help share this message. we're really not just looking for someone who wants a part-time job.
Okay.
While the work might be part-time in some cases, it's not covering a full day of work. It's important for somebody to be committed to doing this in a way that they want to be there is what we're looking for, in addition to just they want a job. And the test really helps uncover that.
That's excellent. That's excellent, because I think the field of healthcare and caregiving is growing. In a few years, the need for caregivers is going to triple, actually. And you really have to find people who are dedicated rather than, just looking for employment. Now let's talk about the clients for a minute. When you're sick, a lot of times you're in pain. A lot of times you're not in a good mood, and it makes you a difficult patient. You're perceived as a difficult patient. How are your caregivers trained to handle difficult clients?
Everybody has different needs as we all age in different ways at different times. It's our job to provide person-centered care and do whatever is necessary to support that person. So they could be living with a medical condition that's making life difficult, and that might make them seem difficult because they're having a hard time going about the things that used to be easy for them. They don't feel as independent as they used to be. So we provide the training that you talked about, but it's really just a matter of, in addition to having a caregiver prepared for any situation, it's being available for the carer to support them when they might need help in that moment. And having an office staff available to talk them through it on a day when maybe the carer is not they walk into work and they're not ready for that. They thought it would be a smooth day. We had already figured out the ones that are prepared to handle that situation as far as it can go before extra help might be needed. But to that point, I think it's just providing more support. The caregiver needs support too.
Have you ever had a situation where you had a client that was so difficult, the agency said, you know what, we're not the ones for this? Have you ever had that happen?
I don't like even hanging up the phone and saying to somebody, sorry, we're not able to serve from what this situation sounds like. So in those types of situations, it's critically important to point someone in the right direction or bring in the other people in the community, like a care manager, working independently, to help coach through that situation and really figure out why the person is acting the way they are, in addition to just collaborating as a team to make that person feel comfortable. If the family ultimately decides we're not adding the right value to be a good fit anymore, by that point I would have hopefully passed them on to somebody else who is a better fit for them.
Those kinds of situations are difficult, and you have to take it by a case basis.
That's
so
right.
Those are the best options.
It's a great point though, because every person is different. So you want to help somebody as much as you can. It's hard to set an exact standard on where the line for what you can and can't do is drawn.
So tell us about the enrollment process for your agency, because not everyone can enroll in one agency. There are different criteria. So tell us about the criteria that you look for.
I think that we are a great addition for many care plans. If it's not somebody who needs help for a short period of time, or to be preventive in being readmitted to a hospital or a rehab center, it's important for somebody to recognize that while there might be skilled professionals immediately available, that insurance might be paying for part of the services in the home, it might not cover enough of the week to keep you home safe and doing everything that you want to do. So as that addition, we have private paying clients who are so often reimbursed through their own individually owned policies.
Okay.
And enrolling is just a matter of customizing a care plan with that family, sitting down, figuring out what this person can still do. Rather than saying and focusing on what the person can't do. By having that needs analysis, we're able to put together a custom solution where we say these are the times of day where you need help the most. These are the things that the carer is going to be expected to do. And honestly, as opposed to moving, it's very simple. The person can cancel at any time with 24-hour notice. So the hardest part is getting started, but we make that as easy as possible to just give us a chance to introduce somebody and start working with us.
Do you accept Medicare and Medicaid?
We do not.
You do not?
No.
Oh, so it has to be private insurance.
You need to be an agency that's licensed to perform the more skilled services in this state in order to be qualified to accept the insurance. We do everything non-medical in the home to complement those other players on the team.
Well, we are going to take a quick commercial break, and we'll be right back.